The Honourable Minister for Health for Palau, Dr. Roberts, Your Excellencies, Permanent Secretaries and CEOs of health across our region and country representatives, partners from development communities, ladies and gentlemen. I was sitting there and just listening to the discussion this morning, and I was saying to myself, wow, 20 years ago, would you ever think WHO would be talking about specialized clinical services and in the manner in which we are sitting today and discussing it? But things have changed, and it's great to see that the global agenda on specialized clinical services is being led by WHO. And for a clinician, a former clinician like me, it actually gives us a lot of comfort to realize that this is the direction. And as you all know, we've moved from primary healthcare to the standard declaration of primary healthcare to universal health coverage. And clinical services obviously is within the gambit of it all. So it's really pleasing just sitting here and seeing the change that's happened over the years and the realization that there is a role to play for clinical services in primary healthcare. And one of the things that has been actually challenging me over the last few months in my new role is actually realizing the fact that often we say primary healthcare as being the first point of care. Well, really it's not. As you all know, with the definition as it is, it means universal health coverage, and actually meaning that we actually bring everything to the fore, and the access and the equity around healthcare. And I trust that all of you who are here, your journey here has been a pleasant one. I also realize that some of you have been here for the last week or so it's been a long time away from your families. And I hope that very soon you'll finish all the discussions, you'll be able to go back home and meet your families. It is indeed a privilege and an honor for me to be here and to participate in this morning's discussion on sub-regional collaboration for specialized healthcare services. And as leaders of the health sector in in the most diverse region of the world, in one of the most diverse regions of the world, I'm quite definite that we are all aware of the magnitude of the health challenges we face every day. We have challenges with NCDs, and as you all know, looking after NCDs, there's a significant cost to it, and also the health resources that are needed in that regard. Looking after NCDs also means that we need to ensure that our health technology and medical equipment are advancing rapidly, and subsequently, that also has a cost to it. Also, pharmaceuticals remains one of the highest expenditure items in our collective health budgets around the Pacific region. And the discussion that was had earlier talked about the economies of scale. And the economies of scale is obviously another place where we face challenges as we try to be able to ensure that we have access to healthcare and the provision of pharmaceuticals and also biomedical equipment. The challenges are real, and the growing burden in the region of diseases at times may seem like they're stretching the limits of our capacity. As you all know, as you would have heard in the media, as of recent, we've had acute febrile illness in Fiji. And this had actually put a burden on our health systems, but I'm happy to say that our people have grown to the task. They've worked through it, and the struggles that we've had over the intervening Christmas and New Year period, we're just now beginning to see that load beginning to decrease in our health facilities. On top of that, we also have the NCD, those who have NCD. So really at the end of the day, we are being hit by communicable diseases, but also at the same time, we're being hit by non-communicable diseases. So when I look at it, and Fiji and the Pacific are not isolated to this. All over the world, we're facing challenges in both areas. And it's therefore vitally important as leaders that we ensure that our health resources are employed in the most efficient and effective ways. And as you all know, several years ago, WHO came up with the Best Buy initiatives on how we can be able to have Best Buy in terms of putting our resources in places where we can have the best impact. This statement is true for the specialized health services, and which can be the most expensive part of our health systems. The dilemma is whether we invest in resources for specialized services or should we direct it to primary care. And there's always a debate on this distribution. And we need to find that striking balance. And it's absolutely crucial that one cannot be over-prioritized over the other. And one thing that I feel very, in my new role, I think one of the things that really has come to the fore is the fact that I also need to champion public health and primary care. And as a clinician, one would think that I would like to champion only the clinical areas, and today we're talking about subspecialized clinical areas, but also as a clinician, we need to also champion primary care and public health, because we are all involved. And as I said earlier, this distribution, this debate on what the distribution should be and about finding the balance. But our efforts need to be in both areas, and we need to be thinking that we're not going to leave anyone behind, because universal health coverage expects it to be so. Increasing costs in medical referrals is an issue we face all over the region, and the NCD crisis and increasing specialized clinical services to be able to look after them. I'm glad that we're having this meeting on how we can better plan, manage, and coordinate overseas medical referral schemes and visiting medical special teams. And all around the Pacific, we have these two very important programs in place with the support and provision of specialist clinical services amongst the Pacific Island countries. I'm also pleased to say that on occasions, Fiji has been an area where we've been able to provide secondary health services to some of our Pacific Island countries who have come and utilized our services in Fiji. We are doing our utmost to ensure that increased quality specialist services are available in the country, and this is through the provision of the services itself, through strengthening and empowering our local institutions which provide undergraduate and postgraduate programs in clinical areas. And also recently our Fijian government ventured into the public-private partnership with Aspen Medical Pty Limited, which you will also see quality medical services brought right to the doorstep of our citizens and at affordable cost. Despite the challenges we face, I'm certain that better planning, coordination, and collaboration and partnership with WHO at the helm will be more efficient and effective in the management of specialized clinical services. I congratulate the World Health Organization for undertaking this valuable piece of research, which we'll hear about the results over the next 2 days. Last evening, I had the pleasure of having dinner with Dr. Kasai and the Honorable Minister from Palau. And afterwards, I heard he was going to catch the second plane. So I invited him to come back with me last night. So he must have just slept 5 hours. And it's good to see you, sir, nice and awake this morning, probably more awake than I am. But these discussions will guide us, and the deliberations, I'm confident, will help us to move forward in innovative, cost-effective methods in this regard. Once again, welcome to Fiji. Please enjoy your stay. Have time to visit the sites. The museum is right across the road, and also try out some of the restaurants and eateries that we have in town. And at the end of this meeting, I trust you will be inspired and motivated to do what is best, improving the health systems to better serve the needs of our people. And before I finish this morning, one thing that I've also learned, that we have a lot of very good people in our health systems. A lot of very good people. A lot of people lay their lives on the line on a daily basis to look after our people. And what we need to do is ensure that the system is in place to look after them, to also ensure that the system is in place to empower them to be able to provide that much needed work at the coalface. And one of the other things that also inspires me is when I see in their eyes that idea of vocation, that they are here to do it because they love our people, and the compassion and the empathy that they have. And with those words, I have much pleasure in declaring this meeting open, if it's not been open, and thank you, and Minawali.
Dr. Takashi Kasai, the WHO Regional Director for the Western Pacific, regrets not being able to join us due to previous commitments. He asked me to send his regards and deliver these words. About 1 year and 3 months ago, the Pacific Island countries gathered at a side meeting during the 68th session of the Regional Committee for the Western Pacific in Brisbane to discuss the very important question, how can Pacific Island countries best respond to the increasing demands for specialized tertiary care? At that meeting in 2017, the recommendation was to have a study undertaken to come up with potential options for collaboration that would either increase the quality of care or reduce costs when it came to the purchase of specialized tertiary health care services across the Pacific Island countries. In 2018, the World Health Organization, in collaboration with the Pacific Community and the NOSL Institute for Global Health at Melbourne University, undertook this study. With your support, either by filling out questionnaires or granting us your time for an interview, we were able to map out the evidence and compile the report that is now in front of you and that will be presented to you over the next few days. Our discussions over the next 2 days are crucially important for Pacific Island countries. We need to be certain that we agree to and recommend as next steps will be beneficial to the population, to the countries, and to the region. Demand for specialized tertiary care services is rapidly increasing, especially in the context of rising rates of non-communicable diseases in the Pacific. NCDs such as cancer, diabetes, and heart disease are chronic conditions which require long-term specialized care. Meeting the demand for tertiary care is a complex issue which involves very difficult trade-offs. On one hand, universal health coverage means people have access to the health services they need, when they need them, at an affordable cost. Within this framework, all countries need to ensure that people who need services such as radiotherapy, chemotherapy, or heart surgery are able to access them. On the other hand, the economies of scale involved in providing these kinds of services in very small island settings simply don't add up because tertiary services require huge investments in infrastructure, equipment, and specialized staff. This is challenging in a remote island setting. Often, the only alternative is overseas referrals, which are even more expensive. Both these options are a huge drain on health budgets, but as the study findings show, there may be some smart solutions and options how to manage, for example, overseas medical referral schemes more effectively on a sub-regional level. There is opportunity to save money. There is opportunity to make better use of visiting medical teams. There is an opportunity to provide better quality management for Pacific patients going overseas. We will look into the findings of the study in more detail and debate, but I'm convinced that there is an opportunity for at least a small number of Pacific Island countries to join forces and make better use of scarce resources. This is not just a national problem, it's a regional problem. And I believe regional problems require regional responses, or at least sub-regional responses. Decisions must be made. There's another generation of patients with chronic NCDs that will require costly specialized care. I'm glad the caliber of country representatives that are present here today are indeed leaders, decision makers, advocates, and policy makers. There are no straightforward solutions, but I'm confident that over the next 2 days' discussion, we will advance the conversation on the issue and come up with some concrete steps on how we can move forward together. Thank you for accepting our invitation, for taking out your very valuable time to be here at this meeting. I wish you the very best on your discussion and deliberations over the next 2 days and an open mind for creative ideas. Thank you.